Hello, I'm Tim Dodge, IABNY's Director of Research and Media Relations, and this is part 5 in our video series, Healthcare Reform, What You Need to Know. In the last episode, I described the role of agents and brokers in the New York Health Benefit Exchange, which will begin enrolling businesses and consumers on October 1st. In this episode, I want to turn your attention to the exchange navigators and in-person assistors. The Federal Affordable Care Act requires every public health insurance exchange to establish a navigator program. Navigators may be either individuals or organizations and will have the following duties. Number 1, maintain expertise in eligibility, enrollment, and program specifications, and conduct public education activities to raise awareness about the exchange. Number 2, provide information and services in a fair, accurate, and impartial manner. That information must acknowledge other health programs. Number 3, navigators and assistors must facilitate selection of a qualified health plan. Number 4, provide referrals to any applicable Office of Health Insurance Consumer Assistance or Health Insurance Ombudsman or any other appropriate state agency or agencies for any enrollee with a grievance, complaint, or question regarding their health plan, coverage, or a determination under the plan or coverage. And number 5, provide information in a manner that is culturally and linguistically appropriate to the needs of the population being served by the exchange, including individuals with limited English proficiency, and ensure accessibility and usability of navigator tools and functions for individuals with disabilities. Now, navigators may not be a health insurance issuer or a subsidiary of one, may not be an association that includes members of or lobbies on behalf of the insurance industry, or number 3, receive any consideration directly or indirectly from any health insurance issuer in connection with the enrollment of any individuals or employees in qualified or non-qualified health plans. Every state that wishes to operate its own health benefit exchange must file a blueprint document with the federal government describing how the exchange will operate. New York filed its blueprint in October 2012 and received conditional approval from the federal government in December. That blueprint, which you can download from the exchange's website, describes how the New York Exchange will operate, and it describes the role of navigators and in-person assistors in the exchange. The New York Exchange is designing the navigator and in-person assister programs to eliminate barriers in accessing the application process by providing in-person assistance in community-based locations frequented by the target populations at times that are convenient to working families, including evenings and weekends. In-person assistors and navigators will be trained to provide outreach, education, and enrollment assistance for public health insurance programs and qualified health plans in the exchange. In-person assistors and navigators will be trained on handoffs to other consumer assistance resources for public programs in the exchange, such as the Exchange Call Center, and handoffs to appropriate referral sources for individuals who are not eligible for public programs or qualified health plans, such as resources for individuals eligible for Medicare. Navigators and in-person assistors will be paid by the exchange and not by the insurance carriers. While the in-person assistors and navigator programs are separate and will launch at different times, their activities will be virtually identical. The IPA program will start in the late summer, early fall of 2013, and the navigator program will be underway no later than January 1st of 2014. Navigators and in-person assistors will have roles in the shop exchange, but the nature of that role has not been defined as of the date of this recording. The exchange is working with the broker community right now to coordinate the roles of brokers, navigators, and in-person assistors in the shop exchange. In-person assistors and navigators will receive comprehensive training that includes the needs of underserved and vulnerable populations, cultural and linguistic competency, eligibility and enrollment rules and procedures, the range of qualified health plan options and insurance affordability programs, including premium tax credits and reduced cost sharing, other private insurance, privacy and security standards, and conflict of interest standards. That's all for this episode. I hope you'll tune in for the next episode when I'll get into everyone's favorite subject, taxes. Thank you for watching. I'm Tim Dodge.